Hello, my name is Sean Willis. I'm a physiotherapist at University Hospital, London Health Sciences Centre. And today we're going to go over the application of a tracker brace or the Breg T-scope brace. And this is most commonly used after knee surgery. We often see it with our high tibial osteotomies, but you may see it with ACL reconstructions with associated surgeries like meniscal tear repairs and that type of thing. With the brace, they're pretty straightforward in terms of the way they work. Essentially what we're doing is trying to limit the amount of flexion and extension that happens with the knee after surgery. And that can be for a period of anywhere between 6 to 12 weeks depending on how the surgery is healing and the type of surgery that was performed. The brace is fairly straightforward in terms of the way it works. These braces are all one size fits all. Essentially they are telescopic braces, so they can be adjusted up and down depending on the length of the leg as well as the width of the leg, so that we're able to open it up nice and wide or close it down quite narrowly. In terms of being able to limit the amount of flexion and extension, there are two dials, one on each side with settings. On the top there's one for extension, so you can set the extension limitation from anywhere to neutral all the way to 70 degrees. And with flexion, you can set it to neutral or 0 degrees and move the dial all the way to 110 degrees. And with that, you can also lock the amount of flexion extension by using this red tab here. By sliding it towards the patient's foot, that locks the brace into extension. By sliding it towards their head, allows you to have the brace bend within the limitation that's been specified by the surgeon. So what we'll do next is we're going to basically apply the brace as we would here at University Hospital, and you'll get an opportunity to see how that's done. So with our tracker brace applications, what we like to do at University Hospital is first to use tubing grip underneath the brace, so over top of the leg. A lot of patients find it quite nice to have this applied to the leg. What it does, number one, is provides friction so that when patients are up and walking around, the brace isn't sliding down their leg as they're moving. The other thing too, some patients find that the brace can be irritating or itchy, so the tubing grip just provides a surface for them to kind of protect the leg with. When we're applying the tubing grip, and you basically choose the size depending on the individual's leg, we want to make sure that it extends beyond the ankle and the upper thigh. What we'll often do is fold the extra pieces over to the end of the brace. Sometimes the end of the brace can be a little bit, it's not as blunt as we would like it, so it can cut into the skin depending on how snug it is. So we like to put the tubing grip over top to fold over the ends. So when we're doing that, what we'll do is we'll basically just kind of line it up. So oftentimes what we'll do is basically have the top end of the tubing grip going right up into the groin and the bottom end extending down to the dorsum of the foot. And what we'll do is just cut that off. And then when we're looking at applying the tubing grip here in the hospital, this is fairly elasticized type of material and it's fairly snug. So what we're using is something called an ortho ring. And what we do is we basically put the tubing grip over top of that ortho ring, and I'll demonstrate that here. And we're basically sliding it on, and this will make the application of the tubing grip that much easier. And then we'll just bunch that up a little bit just on the ring. And then when we're applying the tubing grip, essentially we'll be sliding the leg through the ring up as high as we can. And then what we do is get the patient to grab the end of the tubing grip, hold it in place, and then we slide the ring down the leg so that the tubing grip itself is in place. And as you can see, we've got that tubing grip longer than it needs to be, but that's fine. That's exactly what we want to cover. Next, when it comes to the application of the brace, we want to make sure that the length is appropriate. So the top end of the brace, we want to make sure that it is high enough, obviously, to support the knee, but we want to make sure we're not providing any irritation to the genitalia. So we want to make sure it doesn't grow up any higher into the groin than it needs to be. To adjust it, there are tabs on each side. What we'll do is we can basically slide this brace down, lock it into place. We'll do the same on the other side. And then when it comes to the most distal portion of the brace, you have the, that's okay, sorry. We have the dials here lined up where the knee would bend. When you're looking at the most distal part of the brace, usually what you're looking for is somewhere halfway between the calf bulk and the malleolus. And that's approximately the length that it should be. Anything lower, and most people find that it irritates the ankle. Anything higher, and it probably doesn't support the knee very well in terms of limiting the amount of movement. So we want to line it up to that point, and I think that should be fine. So what we will do here then is just lock that in place. Make sure that it doesn't slide once we apply the brace. And next what we want to do is open up the brace nice and wide so that we can make sure that it has a good fit and snug. So we undo the Velcro here, slide the brace through, and we do that with the other two straps as well. Now as you can see now the brace is quite a bit wider. What we'll do is we'll lift the leg and we'll slide the brace underneath. And again, making sure that the dials line up where the knee would normally bend. And usually what I do first is I like to do the top clip first, just to keep the brace in place as to where I want it. And then what we're going to do is snug up the back first, and then run the top one and Velcro that underneath. Now in terms of the fit of the brace should be snug but not enough such that the patient's toes turn blue or that there's in any way causing circulation issues with the lower extremity. The nice thing about these braces, the tabs do come off so we can adjust the length as we need to. We'll do up the back again like we did with the previous straps. Snug up the front and then reapply the tab so that we can Velcro it on the bottom. And then the last one I do is the one that's most proximal. Make sure that's snug. And then we fold the extra tubey grip over top at the end of the brace. And then we have our brace set and locked here for her. And then basically with the surgeon's instructions in terms of what they're allowed to be able to do, you can then set the range of motion. We can set this one to 120 degrees on both sides. Unlock the red tabs by sliding them up towards the patient's head, and then this will allow the knee to bend so that they can do their range of motion within the limitations that the surgeon has specified. Once they're completed with that, you can then slide the tabs down, making sure that the brace itself is straight first, and that will lock the brace. If you were to try and do it with the brace slightly bent, it doesn't work as well to try and get into extension. So I always make sure that patients are aware that the brace should be fully straight, slide the tabs down, and that will lock it in place.